morning. Is my mic on? Great. Well, thank you for the opportunity to speak today. I'm Corey Capozzo with Global Parents for Eczema Research. And thank you to the organizers for including patient organizations and patients and caregivers in the meeting as well. I know we have a bunch of parents attending virtually, so a special welcome to you today. I'm going to dig into this idea of itch from the patient and family perspective, and also maybe share a little bit of my personal experience with it as well. So just a quick note on our organization. The population we serve is children with moderate to severe eczema and their families. And so this is really the patient population that we know really well. We focus on 3 areas: research, policy, and family support. But our staff is 3/4 parents and patients, so we bring a lot of personal experience to our work. And I do too. I'm the parent of a kiddo with moderate to severe eczema, and this is my son. He was born with severe eczema, and you can tell he's an eczema kiddo because he's wearing socks on his hands. We used to call them sock hands or puppet hands. And you often see these young kids with their hands covered to prevent the scratching. We've already talked about itch being the hallmark experience of atopic dermatitis, the most vexing symptom, the most difficult one to control. And so I'm going to talk a little bit more about this from the patient perspective. For me, actually, as I listened to Wendy's talk, I realized that this is one of those symptoms it's really hard to put words to. And I just wonder how many people in the room actually have experienced eczema-related itch? So maybe just a handful. So it's like, how do you describe this experience? And so I really wanted to focus on stories from patients in my talk to maybe help you understand what this is like, because I don't have eczema, and so I myself am learning from my son and from others. This is data from a recent survey that we did, a global survey with 3,200 responses. And unlike the rest of my slides, these are actually adult patients. But we asked people, what % of your remaining lifespan would you be willing to trade off in order to be returned to better health, to get relief from eczema symptoms? And they're kind of shocking numbers. 30% of your remaining lifespan, these adult patients would be willing to trade off. So the itch, this driving symptom of eczema, is profoundly impactful to patients, and we really need to understand that. When we dig into that data further and we look at which aspects of eczema are really driving that desire to shorten one's life in order to get better health, it's really pain and discomfort, which is where itch sits, and it's mental health impacts, anxiety and depression. And so today I'm going to talk about these 2 related symptoms or impacts. Symptoms and mental health impacts. So beyond it being intensely uncomfortable, unpleasant, vexing, all those things, why do we care so much about itch, especially in these kiddos? And I think there's some hidden impacts that are often missed. And so I'll talk about a few of these. Of course, itch profoundly impacts sleep. These children are not sleeping, they're up scratching all night. You'll hear of people waking up in the morning with completely bloody sheets. They just do it involuntarily in their sleep. And for kids, when you don't sleep, it kind of impacts everything. There's this cascade effect. So these are kids who can't play, they can't focus, they can't enjoy time with their friends. It's interrupting early childhood development. They're not reaching growth targets because they're not sleeping, and that's when hormones are secreted that allow for growth. School functioning is exceedingly difficult when you're that exhausted or that itchy. Try doing math or learning to read. Social and emotional development, interacting with peers. If you've ever done an all-nighter or not had sleep, you're sort of emotionally fragile. And so it's hard to interact with your peers. And then finally, we'll talk a little more about the mental health impacts in just a moment. Here's one that I think is often missed. Oftentimes, these young kids with eczema, their hands are bound up to prevent them from scratching and hurting themselves. And so here's my son, I think at age 3, trying to make a bow and arrow out of a stick in our backyard. And look at his hands. He's in wet wrap therapy, so his hands are, bound up in little fists. and he's trying to break off a twig and make this bow and arrow. And so, because we keep kids with their hands bound up like this, it's impacting their large and small motor skill development. So later, when he had to learn to hold a pencil at school, it was really hard for him because he wasn't using his fingers in the way that most kids were at that age. So it impacts dexterity, and I think there's all these additional impacts that we often miss because they're invisible in the clinical setting. Now he's great at making bows and arrows, so it's all good. So what's it like to live with eczema itch? Those are just a few vignettes, but I want to share a few more. Easter egg hunts. If you take a kid to an Easter egg hunt, this is what they look like. They're thrilled, they want the chocolate, they're gonna run out of the gate to try and find those Easter eggs. And I remember a time I took my kid, my son, when he was maybe 4, to an Easter egg hunt, and this is what he looked like. And we said, go, and he ran out like the other kids with his Easter egg basket. But not a minute later, he dropped his basket, sat in the grass, rolled up his sleeves, and started to itch, scratch. And it just was so surprising to me because it was like there was nothing that could distract him from the itch. It was so powerful that even the prospect of getting chocolate Easter eggs couldn't override the sensation of itch. So it's this sort of trance that takes over for these kids. And here are some photos of my coworkers' kids. And what I like about these photos is it shows those late nights that you spend with your kid, trying to prevent them from scratching. The 3 a.m., the 2 a.m. On the right is my coworker Christine's son and her husband. And he's sitting with him with an iPad trying to distract him from the itch. So these are the moments, I think, that happen when you have a child that's this itchy. Very, very difficult for parents, being up all night like this, day after day. A quote from one of our surveys, I have to hold my son's arms at night to keep him from hurting himself, scratching in his sleep. The itch is just so powerful. And you have this sense of, yeah, your child is woken up from a deep sleep by this itch, and it just has this power over them. It's impossible to ignore. There's an adolescent who said, it feels like my skin is on fire. And so Wendy talked about that interplay of pain and itch and heat, and just feeling like your skin is aflame. This is an adult patient who shared that she takes peppers, like that she grows in her backyard, and breaks them open and rubs them all over her skin, and it burns intensely. But that pain is preferable to the itch, which is this bone-deep sensation that's just so hard to get relief from. So we see patients preferring pain to itch. And I think it's hard to understand how all-consuming the experience of itch can be. And this is something that an adult patient posted online. And imagine walking into a room and the only thing that you can focus on is the things in the room that you can scratch with. And I read this and I just thought it was so compelling and powerful that the only thing you can notice is something that could relieve that itch. I want to talk a little bit about the mental health impacts of itch, but I think this quote gets at it. Because imagine having something this uncomfortable, and the only way to relieve it is to do the one thing that will make it worse. And that torment, the psychological torment that comes from that, you so desperately want to scratch it, but by scratching it, you make the eczema worse and you perpetuate the itch. So the guilt that comes from that, the self-esteem challenges that come from that, I think it's pretty intense. And what other condition has that going on where the only way to relieve this is to do something that's going to continue to perpetuate it? So I'll tell you, this is something I feel really guilty about. When my son was young, he would scratch, and I desperately wanted him to stop because it was making his eczema worse. And so I would say to him, please stop scratching, or sometimes I would yell, stop scratching, because I was frustrated. I now understand they can't stop scratching, and we shouldn't ask children and patients to do this. They need relief from their eczema symptoms and the itch. They can't, through willpower alone, stop scratching. And I think that, we penned this piece a couple years ago to really draw attention to that. We need a more compassionate approach to addressing itch-related scratching in children. They simply can't stop scratching, so I wanted to highlight that point. Let's talk a little bit about the interplay of itch and mental health, which I've touched on already. So this is survey data from Canada by the Eczema Society of Canada. We see in moderate to severe patients, large proportions saying that itch is impacting their mental health. And I think there's some reasons for that. This isn't fully understood yet, but we talked about how, the only way to relieve the itch is to scratch, which makes it worse, and the torment that comes with that, and the guilt. But there's also this lack of control over eczema, and when the itch appears and disappears, that's hugely anxiety-producing for both patients and for parents. You feel like there's nothing that you do that influences its arrival and departure, and that can create these feelings of learned helplessness, among other things. And we do see this psychiatric march occurring in children and in patients over time, where there's an escalation, first with anxiety, depression, and then moving on to more serious psychiatric conditions. This feeling that, again, that it controls you, you don't control it. You're on this roller coaster. You don't get to decide when you come off. You don't get to decide when, the hill starts or you go upside down, and that can really create these feelings of anxiety and depression. This was further, I think, reinforced by a study we did this year with the NIH, our organization, where we analyzed 250,000 comments from patients and caregivers online. And we used machine learning techniques, or a kind of artificial intelligence computing technique, to look at what they were saying. And so we really wanted to understand what are the issues that patients and parents are talking about, to understand where the gaps are. The advantage of this is there's no sort of assumptions going into it. We're really just analyzing the real-world talk of patients and caregivers. And we were surprised by the findings. The number one thing they're talking about is actually the mental health and psychosocial impacts of eczema. And itch was the third topic that they talked about, and these are very closely related. So huge unmet need in this area, and I think these two aspects of eczema really go hand in glove. It extends to the caregivers. These caregivers are experiencing extraordinary levels of anxiety and helplessness. This is data from one of our surveys a few years ago. Almost all moderate to severe kiddos in this, for these caregivers, but you see exceedingly high levels of distress in this population. And then finally, just to reinforce, I think, a point that Wendy made, outcomes, it's really about the itch. Patients and parents want to see a reduction in itch from new treatments. I think we need to be measuring itch in clinical practice to see if the treatment is improving. And so just a plug to really make sure that we're addressing itch in every way that we can. Thank you so much.